People just suffer through symptoms, and a lot of times doctors just put people on birth control as a catch-all that may or may not work. And I see how people get to this point in believing that. I've seen it too in medicine. And we are trained so strongly to favor efficacy, meaning lower failure rates of contraceptives, that some doctors fail to understand what I've been talking about this whole video, which is individual risk aversion. Today, we're going to be talking about birth control skepticism and going through an article that is very interesting that has touched on the topic of a new generation of birth control skepticism and how the face of what it looks like to be anti-hormonal contraception has changed over time. So this is from 19th News, which is an independent nonprofit newsroom. I don't know where they fall on the political spectrum, but I'm willing to bet it's a little to the left. More young women are embracing fertility tracking methods, long popular among Catholics, looking to influencers, questioning doctors, and finding a home in MAGA. This should be fascinating. Kara Stanton didn't get her period until she was 22. For years, doctors, including her pediatrician, recommended taking hormonal birth control to kickstart it, but she was hesitant. All right, so I already have an issue with this because if you are coming up on 22 and haven't ever had a period and you're not on anything that would be causing you not have a period, there should be pretty extensive evaluation by a healthcare practitioner to figure out why you haven't had a period. There's a whole lot of reasons that can happen, and some of them are life-changing and some of them aren't easy to manage. I can't think of many that I would just, without evaluation, go, you know what, you're almost 22 and haven't had a period. You should just go on hormonal contraception. Who knows how it was actually managed, if there was any discussion about that, any workup or not. But you can see how if it wasn't well explained to somebody, that would be kind of your entry point into distrusting doctors, because that is not normal to have no period by the time you're nearly 22. And if the only thing they said was, here, just go on a birth control pill, that's a problem. And I would imagine that that's kind of sown the first seed of distrust for this person. She's now a nurse practitioner in Michigan, and she talks about how, like, she didn't want to just put a Band-Aid on her ovaries if they weren't working. And she was frustrated by the fact that they just kept telling her to go on birth control. She also, and this is now a key point in this story and will help me explain it medically, had been diagnosed with anorexia when she was quite young. And she had gotten treatment for that, but was still quite a bit underweight. And she said that she wasn't really worried about whether or not she'd had a period because her aunt and grandmothers and her mom all were fairly older when they got their periods. So she thought, like, well, they were in their late teens when they got theirs. I might also be, and whatever, it's fine. I'm not worried about it. She goes on to talk about how people just suffer through symptoms, and a lot of times doctors just put people on birth control as a catch-all that may or may not work. And I see how people get to this point in believing that. I've seen it too in medicine. And to me, this is more of a failure of communication between healthcare practitioners and the person who's sitting in front of them, because most of the time, we're not just putting people on contraceptive pills to put a Band-Aid on a problem. Most of the time, what we're doing is using hormonal therapy, which is conveniently marketed and packaged as contraceptive pills, to help with a symptom that is being caused by hormonal fluctuations or lack thereof. And in her case with anorexia, the problem is the lack thereof. So what happens basically is if your body weight is too low, like your body fat percentage is too low, it's essentially your body is trying to maintain its metabolic capacity. And one way that it can do that, if you are starving essentially, is to shut down the reproductive process. And that makes sense, right? Because if you are living in a famine and there's not enough nutrition for you to even keep your body fat percentage up, getting pregnant could be detrimental both to you and, if you end up carrying long enough to have a healthy baby at the end of it, also to the baby when it's born. So that's your body's way of protecting you in times of famine. But anorexia recreates that and your body responds the same. This can happen and cause long delays in starting your first period, or if you've already had periods and then your body fat percentage gets very low because of starvation or overexercise or famine or whatever it is, then at that point, sometimes people will stop having periods. And we see this a lot of times in elite athletes and people who have eating disorders and things like that. The part of this that I take issue with is the communication from the people who were taking care of her, because contraceptive pills in this situation are not a band-aid to mask the symptoms. They are actually a functional and protective entity that is extremely important. After appropriate workup has been done and there has been no other cause identified, and you've decided, okay, for sure what's going on is you have not been having periods because of body weight, whether that's from famine, eating disorder, elite athleticism, whatever it is. The reason that contraceptive pills are recommended is because they are a hormonal treatment for the problem. You're not just trying to make someone have a period. You are trying to protect their bones. So their estrogen is going to be low because of them having but minimal ovarian function to keep estrogen levels higher. And that's why the cycles go away. There's a lot more to it than that, but that's part of the reason. But another really important function of that estrogen is bone development. And that bone development is really, really important, particularly from ages like 14, 15 to 24. Always estrogen is important for protecting your bones, but that's a really critical key point in bone development for you. So putting people on hormonal therapy, which is, again, conveniently packaged as a contraceptive pill, is to protect their bones, their heart, their brain, everything from the effects of hypoestrogen, low estrogen state, when they should have higher estrogen. It's not a band-aid to mask symptoms. It is quite literally a treatment. The fix for the problem is to get the body fat percentage up to a point where your body starts ovulating again. And so that should be combined with dietary interventions and mental health interventions in cases where that is important. And you should be seeing a nutritionist, and we should be working on the root cause of it. But the interim use of contraceptive pills is really important to your health. It's not just a band-aid for masking symptoms. All right, so after that, decided she was going to go ahead and become a nurse. Even though she was kind of fed up with conventional medical care, she still felt like she wanted to help people, but she was a skeptic and a big fan of Robert F. Kennedy for years. She says long before Trump even had him appointed to head of Department of Health and Human Services. I'm sorry, I have trouble saying that because it is so outrageously ridiculous that he is running the Department of Health and Human Services. I digress.
I don't think people should be taking medical advice from me.
She became a Trump supporter, and Trump, at RFK's urging, appointed Casey Means to Surgeon General, and he is anti-birth control pills. Yes, we know that. Now, they're going to go into a little bit of detail about the Supreme Court making hormonal contraceptives widely accessible in the 1960s for people who were married. And just a few years later, the Catholic Church said that they are not okay with contraceptive being used, and it goes against Catholicism, and encouraged the use of natural cycle tracking and monitoring for people who were trying to avoid pregnancy. We can go into a discussion here in a minute, and I'm sure it will relevantly fit into this discussion about how that works. And I'll just do that briefly because it could get very long otherwise. But basically, at that point, that's where you start seeing cycle tracking becoming more mainstream. But it was really kind of niched down into the Catholic Church for the most part at that point. They talk about stats on birth control, and it went from about 20% of people who were ages 15 to 29 using oral contraceptive pills as of 2017. So that's, 20%, that's really not a huge percentage of the population of reproductive age people, but that's a lot of people compared to if you think about the fact that 60 years ago, at the time that was done, it was largely not accessible. I kind of expected it to be higher, especially with as much as people are talking about it. Oh, now they're talking about Casey Means. Jesus Christ. Okay, yeah, so Casey Means went to medical school and dropped out of residency instead to become a functional medicine practitioner. This is a pseudoscience field with no basis in reality or science. And as a proponent of anti-science information, was a perfect fit for this administration's choices for everybody in charge of healthcare decisions. So that makes sense. why such an unqualified person ended up as the Surgeon General. She's talked about birth control, saying things like, oh, we just shut down the female hormone system and pretend like there's no repercussions for that. And she says like that gets to the bigger issue of this, which is disrespect of life. So really making the claim, Casey Means is, when she was talking to Tucker Carlson, that being on hormonal birth control is like anti-life. You know, if you look at it in a pro-life, anti-life movement. Silliness, in my opinion. Sometimes people are on hormonal contraceptives because they like life and they value their own, and getting pregnant would be dangerous to their life. I digress. We know that they don't care about those people. They only care about fetuses. Anyway, so Casey Means, her views on birth control are reflective, and I've seen this too, but the article goes into talking about how it's reflective of a larger viewpoint on hormonal contraceptives that has become a lot more mainstream. In general, hormonal contraceptives are safe. Are there risks? Of course, everything has risks. Every medication has risk. But for the most part, hormonal contraceptives are going to have a similar risk to a lot of medications that you can get over the counter. And in fact, the article doesn't really go into this, but in general, there is an extensive amount of data on over-the-counter contraceptives, and they should be safe to have sold over the counter, particularly when you consider that the alternative, which is pregnancy, people using hormonal contraceptives to prevent pregnancy, if they don't have that and get pregnant, everything that is a risk of being on hormonal contraceptives is 5 to 10 times higher risk during pregnancy and or postpartum period. So this makes it safe as compared to the condition it is preventing. Is there birth control that for some people, they have risk factors that make it unsafe? Of course. Do people have horrible side effects and life-threatening complications from being on hormonal birth control? Rarely, but yes, absolutely. I'm not saying there's no side effects or risk. I'm just saying the data is clear. Birth control is safe and effective for pregnancy prevention and many other conditions. So it talks about how, in the process of this, people have questions, they have doubts, and largely now they find themselves on the internet and looking to people like Casey Means and other people who have really either no medical training or alternative pseudoscientific medical training, and getting their information from them. And like we were talking about when we went through the Alex Cooper podcast, which she did a great job of presenting her experience objectively and not as like a fear-mongering thing, but largely that's not what you see. People get on the internet and they just absolutely fearmonger, and they do it from a place of not caring who that could hurt or acknowledging the nuance that's required to have a really level-headed discussion about contraceptive pills. So anyway, the nurse practitioner that this article is kind of focusing on, she goes through the fact that she felt really dismissed by doctors and that they were not really offering her anything that would address the root cause of the problem. And that, listen, this is an issue. We need to be talking, and I just said it earlier when we're talking about what we put people on hormonal contraceptives if that's the reason for their amenorrhea or lack of periods, for a multitude of reasons, but some of them are not just let's make you have a period. Some of them are really important: bone protection, heart protection, things like that. You need those hormones when you are at that age that she was at. And I agree that it is a serious problem when we have a lack of either communication or discussion of the root cause. So we talked about we need to get the body fat percentage up of the person who is either living in a state of starvation due to illness or eating disorder or famine or whatever it is. That's the root cause, and we need to address that. So the fact that nobody did that for her is both astounding and alarming to me. I'm surprised it wouldn't have been addressed, and I agree with her. It needs to be addressed. So when she went through this, then she went to some alternative places to find information and ended up getting information from fertility education and medical management certification. I don't even know what that is. We can look it up in a minute, but whatever. Essentially helping people learn how to use biological signs to make decisions about their medical care and to prevent or encourage pregnancy using quote unquote natural methods. She says in this article that it helped her have a baby and helps her manage an autoimmune disease. If that's the case, more power to her. But we also still need to have the appropriate understanding of this topic and nuance in our discussions of it to have that discussion and help people without fear mongering. Okay, so now it's going to go into talking about how you do this, like the natural cycle tracking. And a lot of it does come from NFP or natural family planning. Now, hear me out, okay? I don't think NFP or natural family planning is inherently negative. I think if people want to use that to avoid pregnancy, that it's all about your level of risk aversion. And we've talked about this before. There is no contraceptive method that is right for everyone. It's all going to be based on how risk averse you are. NFP in particular requires really, really good understanding of all of this on this board, like menstrual cycle, hormone changes, why certain parts of the menstrual cycle cause certain symptoms like changes in the cervical mucus and things like that. And it requires daily, consistent attention to a lot of biological parameters. You have to take your temperature every single morning, right when you wake up, at the same time each morning, and before you've done anything. Like you roll over in bed, get your thermometer, and take your temperature. It has to be a special thermometer. You have to use a basal body temp thermometer, and you have to consistently do this, write it down, and track it. Also, you have to be paying consistent daily attention to cervical mucus, to symptoms. You have to be tracking everything really closely. And that's fine. If that's somebody's, like, they want to, I actually really enjoy doing that. We used temperature tracking and things like that when we were trying to get pregnant and I was having infertility, and I enjoy it. Like my nerd brain loves that, but I know a lot about the menstrual cycle, and you have to really know what you're looking for and have a deep understanding of that. That's not something that a doctor in a clinic can walk you through. It's something that you have to take initiative to learn on your own if you want it to be effective for you. And it's still got a failure rate. And then once you figure it out and you have all the knowledge that you need, and you're doing the daily attention to all of the tasks and symptoms that you need to be paying attention to, on top of that, you also have to commit to either not having sex during your fertile period or using condoms consistently every time, which still has a failure rate when you are in your fertile period. So you have to be really careful. You have to be tracking really diligently, and it works way better if your cycles are very regular. And someone in the chat has just mentioned that as well. You can still cycle track with NFP and take a guess at preventing pregnancy if your cycles are not regular, but it's way less reliable. So yeah, I'm not against natural family planning or natural cycles app and things like this, but it does require a lot more understanding, self-driven education, and commitment to what you're using, or a pretty low risk aversions. It says, I can interview Catholics studying natural family planning and my hippie friends living off the land, and they're saying the exact same things about birth control and the importance of fertility health for all health. The Venn diagram is now a circle where they do the same action for different reasons. So they're talking about the fact that millennials and older Gen Z are basically the first generation since the advent of the birth control pill where there is a trend away from being on hormonal contraception. I think that that is fine if it's for the right reasons and not out of fear. I used to love being on hormonal contraception, and I was like, you're gonna have to pry this out of my cold menopausal fingers because I want to be on it for the rest of my life. And now at this phase of my life, I actually prefer not being on it and having the normal cycle fluctuations. But that's not because I read something on the internet and I was like, oh my God, my birth control is gonna kill me. It's because that's where I am in life right now, and that's what I want to do. But I also have the knowledge base that makes it easier for me to switch between those two methods without having a lot of fear, because I understand how it all works. And everybody can, like everyone is capable of understanding this, but you have to be really vigilant with it if your risk aversion is high. And I don't think anybody should be fear-mongered out of being on a medication that helps them. Anyway, so interesting quote. An increasing number of women are sketch on the pill. Okay. I guess Gen Z wrote this article. Catherine Pakaluk, an associate professor of political economics at the Catholic University of America, explained that the current conversation around birth control is political and can translate into voting. And she kind of goes into the fact that skepticism about birth control is expanding, reaching an increasingly larger and more secular group, and that the overlap with politics is fairly stark. But that all of a sudden, all of these young Catholic women feel very vindicated because mainstream non-religious people are using their preferred method of cycle tracking and attempts to prevent pregnancy with that, which is interesting. I mean, sure, I guess that could make you feel vindicated. I think it's more just like we have more information now. We have access to information. A lot of that information is presented as fear-mongering, but also people just empowered to make decisions that are better for them. And the access to information is significantly better. I don't know that all doctors approach this in a way that I really agree with, but I think it's fine to be interested in learning about your normal body physiologic functions and deciding what's best for you. I think exploring alternative options for contraception is fine. Again, with the caveat that we just have to know what is our risk aversion. There was a time in my life where my risk aversion was so high that that would have absolutely not been okay, because having a pregnancy would have interfered with everything in my life to an extent that I could not cope with it. And if that's where you are, this may not be the best option for you. If you're really busy, if your schedule is really irregular, if your cycles, there's so many factors that affect failure rates with this, and you just have to decide what's best for you. Anyway, the thing with this is that people who are proponents of it, like this nurse practitioner that the article is about, they come out and they say things like, oh, we're here to make women healthy again, and you shouldn't be on it because the side effects and the long-term outcomes, and it will make you like they spread misinformation, they fearmonger, and then people go off of it without that depth of understanding needed to prevent pregnancy using cycle tracking, and without the knowledge that their risk aversion needs to be assessed prior to it. So they do make a point that hormonal birth control methods are effective and that clinicians are tried to prioritize effectiveness, and that in her own practice, that pursuit of efficacy has left a lot of people with real health concerns being dismissed. And I get that. So I have drastically changed how I talk about contraceptive options based on exactly what they're saying. So what they're saying here is basically that we are trained so strongly to favor efficacy, meaning lower failure rates of contraceptives, that some doctors fail to understand what I've been talking about this whole video, which is individual risk aversion. So for some people, breastfeeding as their only form of contraception may not be acceptable because the failure rate's higher. And for some people, it might be exactly what they want. And that is really important. And so it does feel like people have birth control pushed on them sometimes. And I understand both why the doctors sometimes address things in that manner and why the patients sometimes feel like their concerns and needs are being dismissed by doctors addressing it like this. And we got to find a middle ground where we can have a nuanced conversation about it, which is why now this video is so long, because I've been doing that endlessly. And I think that the person here that they're interviewing is really kind of in line with me as far as understanding that we've got to value the people who are doing this for religious reasons. That's important to know. We need to know the risk aversion. We need to know what this person that's sitting in front of us is concerned about and what makes them feel good and bad and what they value. And these things all go into discussions about contraception. It can't just be right, here's birth control pill, this is effective, IUD is more effective, you should get that, but if you don't want that, then here is birth control pill. Like, that's not how this should ever go. And yeah, I think that we need better education for people who prescribe contraceptive pills in the communication and assessment of where someone's at when they come in to talk to you about it. So this paragraph of the article, I think, is really speaks a lot to what I do here and why I like being on the internet so much, is that there's a real information gap when it comes to people's lived experiences and the information that they're getting from their doctors. And oftentimes, and I have this experience too, that people will come in and they will act like they have, or not act like, they will tell me stories of or on the internet, you all will tell me stories of just being completely dismissed or ignored by their doctor when they've been charting their cycles. And, someone will tell them, oh, you shouldn't be doing that. You should be on birth control. And it's so bizarre to me, because if someone is already bridged that information gap, found the education that they need, they are diligently following this practice. It might be for non-religious reasons, but even more importantly, if it's because of a religious belief, we can't just be dismissing that. This is it makes me crazy, because when people come into our office and we aren't well versed in all the things I've been talking about in this discussion and the nuance of how to have this conversation, or if your doctor doesn't know anything about cycle tracking and can't even tell you where to start to get that information, or what you'd be looking for, or how much time and work is required, then at that point, people are like, well, great, the person who's supposed to give me answers doesn't know the answers, and I guess I got to go find someone else. So they go to this 2023 study, which I find really fascinating, and it was in the journal Health Communication, and it found that 74% of YouTube influencers who talked about birth control encouraged people to discontinue hormonal birth control. I hope that I was included in this study somewhere and that I'm in the 25% who wasn't doing that. But that's important, right? That's what we've been talking about this whole time, is that people get on the internet because their doctors don't know anything about the questions they're asking. And what they find are people who are fear-mongering about contraceptives and encouraging people to go off of it. And then in 2024, they found the same thing on TikTok. It's a little lower, and TikTok does tend to fall into a category where it's still a lot of misinformation there, but it tends to be a little bit less than other social platforms, in my opinion. But 50% of TikTok influencers who talk about hormonal birth control are encouraging people to discontinue it. It's not just that this random person on the internet is telling you to go off your birth control pill and that they have no education on it. It's that there is an air of expertise, or the illusion of this person having knowledge because they have people listening to them. And that is certainly not always the case. But it is a phenomenon that we see, especially in the population of people who would be potentially wanting to be on birth control or considering going on it or off of it. And so when you have all these people who are pushing a narrative that people should go off of it, and they're influential, and we know that the research says people trust them, this is how we get to this age of people having so much skepticism and fear about hormonal contraception, not knowing who to ask, because the doctors are not appropriately assessing the person in front of them as a whole entity when discussing this, and just kind of defaulting back to what we learn in medical school, which is to prioritize efficacy. And then you have this recipe for disaster. And inevitably, people are going to go off of their contraceptives and end up with an unwanted pregnancy, and then be in a situation where they're either religious and opposed to abortion, or they just personally don't want to do that, or what is far more likely in the US at the moment, they won't even have the option to have a termination if that's what they want. So these are really important conversations to have, and we are really seeing the beginning of really negative outcomes from this, in my opinion. They're planning a virtual conference in October through FACTS as a mechanism for bringing more people in this space into contact with evidence-based research. For the influencers out there, we encourage them to come and learn more about lifestyle factors like nutrition and sleep on fertility. That's interesting. I wonder if I want to speak, just putting it out there into the universe, manifesting that I'd love to come to that, and I would love to speak or be on a panel or lead a discussion group. I would love that. Please email me. So they're talking about a nurse practitioner who is an influencer on Instagram with 20,000 followers, and talking about tips on nutrition and how it impacts reproductive health. And then I guess this person said that they had a discussion about menstrual cycle tracking and body literacy, and she only discovered that when a physician gave a talk at her clinic about cycle tracking. So that she says, I know firsthand that birth control isn't going to fix every issue, that she was prescribed hormonal birth control and it didn't bring her period back. And then later on, she was diagnosed with infertility and needed IVF, and that she wants people to understand their bodies and fertility better. Let's see. When I'm telling all my friends about fertility awareness-based methods, or even teaching my 37-year-old cousin about these things, they say, this is crazy. We weren't taught this. And I totally agree with that statement. Totally agree. And that's why I exist on the internet. I love teaching this stuff. I have like, this thing's as big as me, guys. It's huge, right? This is my bedroom. I have a fetus light and all these lovely reproductive flip charts in my bedroom because I am a nerd and I love this and I love teaching about it. And I do think everybody should learn this. And it's shocking that we don't. But that is a recipe for disaster when you have people who don't learn this. They get their information from biased sources, and then we fearmonger everybody into going off of medication that could be really helpful for them. Or you get the opposite side of that as well, of people who are too afraid to go off of it and just do cycle tracking and stuff because they don't know anything about it. And maybe they fall, left on the political spectrum. And over there, it's kind of like, no, that's like what the people over on the other side do. And like, this isn't political. This isn't political, right? We all deserve to know about our bodies and our reproductive health so that we can decide what's best for us and prioritize that in a safe manner. Not because we were scared out of being on a medication because we listened to a TikTok influencer who couldn't explain the menstrual cycle to you if they tried. Man, I got real passionate there for a minute. I am a super nerd. Okay, that's a little embarrassing, but carry on. Let's go. So yes, it is crazy that we weren't taught that. And it's crazy that I didn't learn about fertility awareness-based methods in medical school or residency. Like, I should have learned about that, not on my own time. That is important, but it's just not the way it is at the moment. And I want my girls to learn how to track their cycles when they're older because I think it's important and empowering. Most importantly, it is empowering. This has really been an interesting article to go through. I'm glad that we chose to go through it because I think it really highlights some of the things that I'm really worried about with the internet, and the reason that I always am when these influencers have big viral videos that do lean towards encouraging people in a what I consider to be irresponsible manner to go off their contraceptives, that I post about it or I'll do a reaction video to it. And this is the reason. The reason is because I think we need people to be informed in a non-scary way and to be educated, empowering them to take control of their health so that they can make informed decisions, because birth control pills are going to be great for some people and not for other people. And they may be wonderful for you at one point in your life and something you have no interest in at another point. And that's okay, but we have to have the information. And hey, that's why I exist on the internet, because I want to try to combat some of that. And I hope that I at least do a moderately good job at that most of the time. So yeah, thanks everybody for listening to that. I feel like I just ranted. I don't know if that's gonna make a YouTube video or not, but I hope that it makes for a good discussion on YouTube.